Yeah. Let me first maybe just say a little bit. I won't be talking so much about specifics about individual children, so those questions are a little bit hard to answer. You'll see how much assessment we do going in to determine the right level of program and the focus of the program. This workshop is really geared more towards parents that want to start off services, but I think, all of you that are here could probably benefit from hearing some of the materials, I'm hoping. So, I didn't even test my, no. Okay. Let me just start off so we're on the page with ABA, what is it? Just a definition, so we're starting off together. Obviously applied behavior analysis, and it's a science in which procedures are derived from principles of learning or principles of behavior, and they're systematically applied to improve significant behavior. We're looking at significant improvements and meaningful behavior. So not just some random thing that doesn't make a difference. We're looking for clinically significant changes is the focus of ABA. And it's demonstrated with data that the change is there. So it's very data-based, and that's a big focus as well. And as I said, to see some responsible improvements in behavior. ABA, little caveat, but you've heard this, and it's some of the criticism, I guess, ABA gets, rightly or wrongly. It does not lead to overnight results. It's not a cure. That's an area that gets thrown out a lot. You could definitely see great improvements, and so it is one of the treatments that has the most scientific support behind it, but it's not something where you're going to see overnight results. So it requires a very intense commitment, which you'll see today, an intense amount of time. It financially can be very intensive, and the consistency that is required. When Jamie and I supervise the home programs in our practice, we do a lot of, we were on this step, what does this look like? We do a whole lot of instructor observations, either by video or in person, with some very immediate feedback to see some changes where we get that consistency, and it requires a lot of direct oversight and support to the program so that the changes can be seen. Of course, our program also, we do a lot of focus on the quality of the program where you can see the changes, because why do it? It's so intensive if you're not going to see the changes. Why is it important to do a home-based ABA program? How many of you all have children who are receiving ABA services in a school setting? So a couple people already. So you have your child receiving some services in school. Anybody already doing home-based ABA stuff? Anybody? A couple people are already. So why do the home-based, especially if your child's already doing a school-based? One thing would be that it's been consistently found to be the most effective intervention for kids on the autism spectrum and older. The outcome is related to, one of the new research studies in the last few years that came out said the outcome is going to be related to how early you start. Doesn't mean if you start later that you're not going to get gains, but earlier you start seems to be a higher likelihood that you're going to have a better outcome. How much you do, and this is looking at number of hours. There's no magic number. 40 came out originally as the original study, but it's not very clear if you need to do like this when you hit 40, all of a sudden you're going to have a light bulb go off. You're doing the best you can with the most hours you can do. The quality is important. So how good of the service is, and then some child factors that come into it. The child's cognitive functioning, if the child's verbal initially, some of those factors are associated with better outcomes later. So why do the home-based ABA? We know that it's the most effective. We also know that if you do home-based, you're more likely to increase your child's access to ABA. Good, right? And you have some control over doing early intensive and behavioral intervention. Not just early intervention, but it's behavioral intervention. So you have some more control over that if you can implement it on your own. And it also can extend the school services to your home, and hopefully see some carry through. We do a lot of coordinating where we like to say to the family, and some of this is just negotiating what we're going to be able to do with what resources we have. We'd like to try to go into your child's school like once a quarter and see what they're doing. And we'd like to try to talk about what goals are there. We'd like to be part of the IEP. We'd like to really form a good rapport with the teacher so that when we're working on X, we can maybe share the target list with them or find out what their target list is. It's very sad when you find out that we've been working both on yes or no programs and the targets are going different directions. It doesn't help anybody, so that consistency is important. Among the benefits of doing a home-based program, obviously you see that you can program, since you're in control of it, the ratio, 1-to-1 for example, and the intensity. of the services, so you have some more control over how it gets programmed and that kind of intense nature of it. It can be focused on the specifics of your child, so you're hoping that the schools are doing that, and many of them, may be doing that, but you're really looking for what are your child's individual needs and do those programs match it. If there's some toileting issues going on, if there are problem behaviors occurring, are those prioritized and addressed first? So that it's not that all kids that are in a small group are working on the same programs. Your child's programs are very specific to their needs at that time.